You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Good morning, everyone, and welcome to the Health Hub. I'm Cathy Biase, your host, and along with our producer, Alex Diaz, and our production assistant, Daniel Tersini, we would like to welcome you to our show this morning. Good morning, everybody. Good morning, guys.
Good morning.
Good morning.
How are you guys doing?
Keeping well.
Yeah, holding up.
Do you guys watch the playoffs at all? Are you into this?
I tried to, but I wasn't able to as much as I wanted to, but for the most part, for me personally, I'm almost glad that I didn't, because I realized how stressful it was. I know you were at the game, right?
Yeah.
I believe for the Raptors, that was kind of disappointing. But anyway,
I'm not a huge sports fan. I didn't really keep it. No, I did hear about what happened in France, though.
The cathedral.
Yeah,
that's Notre
awful.
Dame.
Yeah, my last viewing of what was on the news was that they were able to preserve a lot more than they had originally thought. I haven't seen anything this morning.
I haven't spent too much time, unfortunately, reading into this, but it is very devastating. It
is devastating, and like I said, what I read, they were able to preserve the crown of thorns that was in there, and some other very important pieces of artwork and religious artifacts. That's what I last heard. I have, in all honesty, not followed up with it this morning, but really very sad, especially going into Holy Week, an iconic architectural cathedral like that. It's very sad that that's happened. So
it is
very tough for the people and for all of us. Really, it's a tragic loss. And as I said, I don't know too much more about it. I'm not sure if they've known or are up to what has happened as far as how this whole thing started, but all the best, and here's hoping that we can survive. Much more of it can survive than was originally anticipated. So anyways, on to Holy Week. I'm sure that you were very busy with the scheduling in the studio, or has that changed quite a bit for you?
It's as anticipated.
Yeah, very busy.
But very, very, very productive at the same time. So
good. It's I hope everyone has a very blessed and meaningful Holy Week as we move into the biggest the biggest event on the liturgical calendar, which is Easter.
Yes, it's one of our longest seasons as well. Apart from Ordinary Time, of course. It's I think it's 7 weeks, I believe, Easter. Yes.
Every year Lent goes by faster and faster, though. It's I find it hard to believe, but yes. So good luck with everything this week for you guys, and everyone have a blessed Holy Week.
Thank you.
Today's show is live. Our number is 416-245-1534. Please follow us on all of our social sites. We are on Instagram, Twitter, and Facebook, and our handle on each is at the Health Hub RMC. And again, feel free to email us at thh@radiomaria.ca. We love to hear from you on all fronts. I like to directly respond to the emails that we get, and it's very nice to know that you're out there listening, and I do really appreciate it. Also, please subscribe to our podcast. We are the Health Hub on iTunes, SoundCloud, and all your favorite podcast platforms. And you can also find our podcast on the Radio Maria Canada website, which is www.radiomaria.ca, and on my website, which is cathybiase.com. The podcast, the live show, and on the tape shows are usually changed over weekly. So by the end of the week, before the next show, we, on most occasions, have the previous show's podcast up and going. Last week's show, Building Health Relationships with Jonathan Thomas, is up and ready for you. That was a very nice show, and it was really nice to have him in studio. So I think you'll like that. We've had a few people contact me and say that they really found Jonathan, not only very informative, but a very easy person to listen to. So do take a listen and let us know what you think. So I wanted to talk to you today about vitamin D. I don't think this is something that we've talked about on the show before, and it's something that is extremely important that we know about and that we have in our systems. Vitamin D is sometimes called the sunshine vitamin because it is produced on our skin in response to sunlight. So that is a key piece to listen out for here. It's we make it, but it has to be in combination with sunlight. It's a fat-soluble vitamin, and it has many important functions in the body. Perhaps the most vital are regulating the absorption of calcium and phosphorus and facilitating normal immune function. It's been studied quite a bit, and deficiencies of vitamin D are now being shown to be linked to breast cancer, colon cancer, prostate cancer, heart disease, depression, and weight gain, to say just a few of those, and many more. We need vitamin D to help our gut lining work. Many, many important functions of vitamin D. Vitamin D comes in two main forms, vitamin D2, which is ergocalciferol, and vitamin D3, which is cholecalciferol. Vitamin D2 is found in plants. D3 is found in animal products, if you're consuming this in your diet. Most studies have shown that the D3 that we get from animal products is absorbed and used by the body better than D2. But with our 4 seasons here in Canada, we do struggle to get adequate levels of vitamin D. So many of us do supplement with it. We just can't, even in the beautiful sunshine in the spring and summer. We are clothed for the most part. We don't have a lot of exposure of our skin to the sun. So the vast, vast majority of people need to supplement with vitamin D. A side note is that you should get your vitamin D levels checked because you can't have too much of it in your system. So we want to make sure that we have the right levels. I have many people have told me that they're supplementing with huge amounts of vitamin D, which may be fine, but it is important that you do get your blood work done to know that you're not over and to know that you're not under. You want to be in that sweet spot. So vitamin D, as I said, vitamin D3, the most readily used by the body, is present naturally in only a few foods. Cod liver oil and different types of fish such as salmon, tuna, and mackerel, and in eggs. So most of us will need a supplement. And a fun fact is that most vitamin D supplements are derived from lanolin taken from the wool of healthy live sheep. Lanolin is a waxy substance, comes from the wool of the sheep. It sometimes is referred to wool wax or wool grease or wool fat. And the lanolin that the sheep secrete makes their wool water resistant and protects their coats from the environment. Lanolin is a byproduct of wool farming and is gathered after the sheep have been shorn. So I thought that was a very interesting fact to know where vitamin D came from, and I thought I would share that with you. So on to today's show. Very excited to talk to Dr. Antonio Stecco. He's an MD and a PhD and is assistant professor at Rusk Rehabilitation at New York University. He is a psychiatrist and is president of the Fascial Manipulation Association. Dr. Stecco was assistant to the president of the International Society of Physical Medicine and Rehabilitation from 2012 to 2014. His scientific activity is devoted to the study of human fascia from macroscopically, histologically, and physiopathology point of view. He has made over 100 cadaver dissections for his research, and since 2007, he has organized and personally holds theoretical, practical courses about facial manipulation method in all 5 continents. He is author of more than 40 in extenso papers about fascia, and he has co-authored 5 books and is co-author of different chapters of international books published by Elsevier. Our learning points today are: what is fascia? I'm going to confirm it's fascia. I say fascia, but I was listening to some YouTube videos and they say fascia. Why is fascia so important? And how can manual therapy treat fascia problems? So we will be back to talk to Dr. Antonio Stecco.
unspeakable joy. So let our feet do all the talking when our words fall short. We got reason to get up, reason to get down. He's untreated, unshaved for joy, and now that joy wants all. Happy dance.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back, everybody. Our show is live today. If you'd like to call in, our number is 416-245-1534. And again, please do follow us on our social sites. We are on Instagram, Twitter, and Facebook at The Health Hub RMC. Dr. Stecco, welcome to the show.
Yes, hi and welcome everybody.
Dr. Stecco, your family has a long, deep history with the study of fascia. How did you get involved in this?
Well, first of all, I was treated by him. So when you see the result, when you are a young athlete that have a multiple injury and you want to be fixed soon, have a physiotherapist in home, it will be the best solution to get treatment, to be interested, to get involved in this fascinated argument that is fascia.
Well, can you give us a broad overview of what exactly fascia is?
So fascia is like a layer of collagen fibers that surround muscle, nerves, vessels in different levels. So we can simplify like a long sock that cover all the leg, a long sock goes that cover all the arm, but at the same time it goes in and reach the bone. Like if you cut transversely an orange, you see like the septa that comes down in the center of the orange.
So it's pervasive throughout our body. Now, the fascia at these different levels, are they performing different functions, and are they structurally different?
Well, if we want to simplify, we have like three types of fascia. We have like what we call superficial fascia that is in the middle of the adipose tissue, in the middle of the We have the deep fascia that surround the muscle, nerve, vessels. And then we have the visceral fascia that cover and connects the different organs. Each one has a different function.
Can you go through them with us? Just the 3 levels?
Yeah, so like the superficial fascia inside the hypoderma, it surrounds like the vein, like the saphenous vein that we have in the leg, is in connection with the skin. So it's very related to like lymphedema, varicose vein, alteration of the quality of the skin. So all these kind of alterations can be related to the superficial fascia. Then we have like the deep fascia. And the deep fascia is more related for muscular transmission of force. So it will work for range of motion. It will work for mechanical transmission of force through the limbs. And so when there is a disorder of the deep fascia, you will start to have rigidity, you will start to have pain, lack of proprioception. And finally, the visceral fascia that is inside our cavity, they work for the mobility and motility of the organ. So when you have like a particular type of constipation, a particular type of are very related to the of the quantum visceral fascia.
Okay, so we're getting a little fuzzy on our end. So the fascia is involved in all levels of the body tissue. And you were saying that any pathology that you might see with the fascia, pathology might rear its head in lymphedema, varicose veins in the superficial level. And then you even got as far as saying that fascia within the intestinal tract, if there's pathology to it, can lead to constipation. Is that right?
Yes. We normally avoid to use pathology because when there is a pathology, there is already an alteration of the anatomy. So that is already a very late stage of the process. So when the problem is on and off, that is when we can really apply, a treatment focused in fascia to restore the function and decrease the symptoms. When it's too late, as we say, like a varicose vein, when there is too much dilatation, that is too late because we have a really completely change of the anatomy.
Well, something like lymphedema caught my ear when you were saying that. Is lymphedema, so this is a chronic condition for many people, especially women who have had surgery, breast cancer. I myself have lymphedema. Is the fascia, manipulation of the fascia, and we'll get into that therapy in a little bit, is this an area that working and trying to increase the health of the fascia can be used within lymphedema?
Yes, because all the lymphatic system in the periphery, it collects the lymph from the subcutis inside the lymphatic duct. The lymphatic duct, they travel in the superficial fascia, and then they go through the deep fascia in the deep compartment. So if the superficial fascia is rigid, it decreases the ability of the lymphatic system to drainage. And if the deep fascia is as well, the hole where the lymphatic ducts go through the deep fascia can collapse. It can decrease the amount of lymph that can go from the skin to the deep compartment, so drainage it to the system.
Even when lymphatic ducts, the nodes are removed, so even when nodes are removed, can manipulating the fascia help to overcome the lymphedema that some people suffer?
So when you have surgery, obviously you change the anatomy, but
right.
Your lymphatic system is very smart, let's say. You have a lot of paths to drainage the lymph. So if you can restore all the collateral paths for the lymphatic drainage, also if you have a sacrifice with surgery some lymph node, the other path it can take care of the majority of the leaf. So our major target is to restore at the best the area that were alterated by surgery, but not sacrificed by surgery.
That's fascinating. Now, I don't know how long you've been actually doing all the research. I know your family, as I said, is deeply invested in this. But years ago, fascia was just basically considered like a saran wrap, was it not? Just something that wrapped around your organs and different aspects of the internal body as a protection. So the change in our understanding of fascia has greatly increased through much to do with a lot of your research.
Well, the most important article that we published, it was the first one, now we have many more, is about innervation. So as soon as we discover that the fascia is extremely well nervated, much more than tendon, much more than ligament, all the fascia start to become a very important tissue for pain generator. It comes to 10 years ago. So like the first article was 2010, basically. So since then, nobody knew that the fascia is a clear pain generator. So the people thought that it works for a mechanical transmission, to wrap up the muscle, to permit the gliding, but they didn't know that the fascia can generate pain.
And is that the focus of what you're working on is decreasing pain? Or are you also trying to work on... Now, is the pain... So the pain you're saying is the fascia itself can create a pain sensation, but is the pain then... Is it an inflammatory thing that then inhibits the other functioning of muscles and anywhere else that the fascia is located?
Yeah, this is very important concept. So we found that the fascia can become more rigid. If it becomes more rigid, it can compress, it can squeeze the receptor, the nerve receptor inside the fascia. So it's not a really inflammatory pain, but it's what we call nociception pain. So it's a pain due to an irritation of the freehand nerves and the nociceptor. So for this reason, most of the time with ultrasound, with MRI, you don't see any alteration. You don't see an inflammation, but the patient is in pain. So that pain is, for the majority of the time, due to alteration of the stiffness of the fascia that will generate a nociception.
So something like fibromyalgia or a frozen shoulder that has been so hard to treat could possibly be a misdiagnosis where it's the fascia that's causing the pain as opposed to the underlying joint or the muscles surrounding the joint? Yes.
So we published more than 130 articles in PubMed. We have more than 10 randomized controlled trials. And we prove that pain in the ankle, some pain in the knee, in the shoulder, in the neck. So pain that are not related to major anatomical alteration, really related to a stiffness of the fascia. So fascia is involved most of the time. In a percentage, it can be like 80% of the problem, 50% of the problem, but alteration of the fascia is extremely common. And now in NYU, we have a new MRI that is able to understand better the alteration of the fascia. So we can have a quick diagnosis.
Really? So, I mean, it's very hard to diagnose a muscle issue with any sort of imaging. That's still, from my understanding, that's the case. So this is extremely pertinent for athletes, for people who can't get down and figure out where their pain is actually coming from. Is this something that's very well known right now in the medical field, or is this just something that's coming on the horizon for most people? Would many doctors know about this?
Yeah, unfortunately, like 10 years is a very short amount of time. So we present in more than 50 countries. For instance, in China, we present in many universities. Also in the U.S., we are present in many universities. But still, a bit. So to let the people know all these anatomy, this physiology, this pathology, it will take, years and years. It's not so easy to spread this knowledge. But the situation is changing dramatically. So, for instance, the first Fascia Congress was in Harvard in 2009. And now we have a Fascia Congress in all over the continent and with 1,000 participants. So it's an exponential change in the medical field and healthcare professional field, but it's still a bit for in comparison to what can be done and how important is this knowledge for every clinician.
Are you at the point where you can understand how to keep fascia healthy to sort of not get to the state where there's pathology? Do you know enough about that yet where you can say perhaps diet, lifestyle, or right now can you only deal with the symptomology of the fascia issues?
So, fascia can have also pathology. So we say that the fascia can have a fibrosis that is a really pathology, what we call densification. It is the alteration of the lubricant that is inside the fascia. So fibrosis is like scar tissue. So surgery, big trauma, they will generate the scar tissue. So the fascia becomes very thick, very rigid. With a MRI, you can immediately understand if it's something wrong. There is too much connective tissue. So this is quite rare, but very dramatic. But and we are doing a lot of research in NYU right now, is what we call densification. So the lubricants that are between the different layer of fascia can change from a simple lubricant to a glue, to something more sticky. So if it changes, they become more viscous, obviously the gliding will decrease. So the patient will start to feel like stiffness in the joint. The stiffness, it will be related to an irritation of the scaly nerves, so pain. So this is it's something relatively new. Let's say this is new. It's a little bit more difficult to make diagnosis because you need what we call elastomosonography. There is a particular ultrasound. All these new MRIs we have organized in NYU, that the name is T1RO, that permit to quantify the type of lubricant between fascia and muscle.
Okay, so just to recap, densification is one of the issues that this is part of the pathology, and the lubricant is the lubricant within the fascia or between the fascia and the muscle, or the fascia and the organ? It's between, not within?
Yeah, so in reality, fascia is made by 2-3 layers of collagen fiber.
Okay.
So when the fascia have lubricant inside, they have lubricant between fascia and muscle.
Okay. And so when that lubricant gets viscous, when it gets glue-like, that is what can cause pain and stiffness, and that may be the cause of people's issues as opposed to what we would just refer to in the past as a sore muscle.
Correct.
Interesting. Now, what causes this lubrication? I don't know if you know the answer to this yet. What causes this lubrication to get gluey?
Well, we have a lot of articles. So in vitro, there is a lot of articles that explain that. So they already prove that decrease of the temperature make more viscous. Immobility make more viscous. Overuse, so overproduction and accumulation of this substance make more viscous. Decrease of the pH make more viscous. So for instance, athletes that produce a lot of lactic acid, it decreases, like it increases the viscosity. So at the end, for instance, of a marathon, you feel stiff. Or when you work out a lot, you can feel stiff for a couple of minutes. Because when you decrease the pH due to the lactic acid, the viscosity increases. Or the first step in the morning, you feel heel pain, you feel ankle pain. Why? Because immobility makes more viscous. So this substance is basically hyaluronan. Is like ketchup. So if you leave it, it becomes sticky. If you shake it, it becomes...
Are you there? Oh, Alex, is he here?
It is not arthritis. It's not muscle problem. It's fascia problem.
So where's the line between overuse and underuse then? Can we work out too much? Or is this a rebound thing? Or can we cause permanent damage from continually working out too much? This is very interesting to me.
Well, we are working to try to define what could be the good range between immobility and overactivity. We don't have data yet. It's difficult to collect data about that. But obviously, it's in the middle of the best because too much mobility, it can drive stiffness. But accumulation of these lubricants, which produce a particular cell that is covered, we call fascia sites. So these cells produce the lubricant. But if you leave too much lubricant together, it aggregates, it becomes more viscous. So obviously, you have to move. It's good. The physical activity is very important. When you do too much, it will be important the area to avoid this aggregation, this increase of the viscosity. So we have tried to figure out what's the best way in stretching, elongation. We are still in a work in progress.
So stretching is key, especially after working out?
This is our hypothesis.
Mm-hmm. Okay.
And we have tried to see with some study how is the factor and how works to avoid this kind of stiffness that can accumulate.
Now, again, this might be too early on, in working with athletes, is there a recovery time, or have you noticed when you're following athletes that there becomes a breakdown as time goes on?
Well, obviously, athletes, they accumulate this viscosity, this stiffness around the body. So we don't know at this time when and where it's too much. But we already saw the outcome. So we follow a lot of team. We do also pre-season evaluation. We publish an article explaining how a pre-season evaluation, a pre-season treatment can decrease the injury. Because we know already at the beginning of the season, if an athlete has too much that they have stiff, it could have more possibility to have a minor or major injury in this case. So, last month, we proved that two soccer teams, the one we treated at the beginning of the season didn't have any major injuries. The other one had 2 minor ankle sprain and 2 major ankle sprain. So, treatment, it can affect the quality of the performance of the athlete.
Okay, so let's get to your fascia manipulation, because this is... again, something very, very new on the horizon. Can you explain to us the therapy that you are teaching now and implementing on people?
So fascial manipulation was found more than 40 years ago. It basically is a manual therapy that generates a deep friction in specific spots that we have mapped in the body. So area that they are key from a biomechanical point of view. So this area, the fascia and the muscle could guide very well. So if we feel through a manual evaluation that there is a lack of gliding, we know that the distal joint is not working in a correct situation. So the vector that will reach the joint is incorrect. So we want to restore the gliding between muscles to let the joint distally work properly. So what we do, we assess the patient palpating different spots. In the combination of spots that work for specific direction, we treat with a deep friction. That can take like 2-3 minutes, 4 minutes, depending on the chronicity. And right after, the patient has a result immediately. In fact, we don't treat more than 2-3 times. But what the people appreciate that we are able to give a long-lasting result. Because with our randomized control trial, we prove that with 3-4 treatments, we can give more than 6 to 9 months follow-up pain-free. And that is what makes the difference and what people appreciate of this method.
Is the manipulation with an instrument, or are you strictly hands-on?
Hands-on have a double advantage. The first of all, that you have a better feedback about how tissue are changing. Because you feel clearly with your hand that the tissue from stiff or rough surface, rigid surface, becomes soft, nice gliding. So you feel the change, and you know when it's time to stop. Plus, if you use an instrument, you can bruise the skin. And fascial manipulation doesn't bruise the skin. So it's painful treatment. But the skin is perfect, and this is a great advantage when you use your hands.
Are you able to get to the deep fascia with the manipulation by using your hands?
Yeah, lucky for us, the fat is soft, so you can squeeze each work in a specific spot, because we're working like in a spot like 2 centimeters square, even less. Sometimes it's 1 centimeter square. So when you need a small surface, you can go deep. It's when you work with a large surface that you are not able to go through the fat. So lucky for us, we have to work in a very specific area. And so with the tip of the knuckle, with the flat porch of the elbow, we can reach the deep fascia, and we can really address our treatment in the tissue that we need.
That's fascinating. Who is able to learn this technique? Anybody? Can anybody sign up for the program?
Hello?
Hi there, Dr. Stecco. Can you hear me?
Yeah, I can hear you very well.
Okay, good. I was just wondering, who is qualified to learn this treatment? Can anybody do it, taking your courses?
So we need a strong background in anatomy and physiology. So we accept medical doctor, DO, PT, DC. In Asia, other healthcare practitioners that have a 3-year of under bachelor degree. So we need a clear background that permit them to analyze the body properly, and they have a license that allows them to practice directly with the patient.
And do you have courses just for people who may be interested in understanding more about fascia?
Yeah, we give a lot of workshop, even anatomy dissection course, because this information are useful for everybody. So from clinician, but also for people, general person that we want to know why fascia is so important for our body. So we provide many education course also during Congress because we believe that this information has to be spread all over. Mm-hmm. And we try to do our effort to do that in all the countries.
And your basis is in New York, and you are, okay, so where have you seen the most benefit for people? Back pain, fibromyalgia, where have you seen the greatest success?
Well, the more dramatic response you are in acute pain. So whenever the people have like acute neck pain, acute shoulder, acute elbow, so acute pain, you see a dramatic response already on treatment. because when it's acute, the fascia is extremely stiff. So it's enough to put like 1 point, so like 3 minutes, and the pain drop. So the decrease the pain from 10 to 4 is not so difficult. Mm-hmm. It's more difficult to go from 4 to 0 because you have to really restore completely the biomechanics in that area. So for this reason, we have let's say successful results, in particular, and mostly because a lot of people take our course for musculoskeletal problems. But we work also for an internal disorder because the visceral fascia is even important for our body.
Is there anything we can do other than stretching to help keep our own fascia healthy? For instance, a foam roller. I know that that's probably as close as we get here to home therapy for fascia, but is there any other suggestions you can give us for keeping our fascia healthy? So,
stretching for sure is useful. I can maybe suggest a static stretching for the inferior limb, a dynamic stretching for front and upper limbs, because the fascia in front is more
okay.
Other than that, we know that the heat decreases the stiffness. So
heat.
The person say, look, heat. Yeah. Okay. All the person say, look, when I have a hot shower, I feel better. It's a clear sign that there is an alteration of the fascia. So all these also patients say, look, they suggest to put ice over my shoulder. But in reality, a hot bath, a hot package, it works better. It's clearly a sign that is a myofascial problem. It is not an inflammatory process. Because
that's very interesting.
Yeah, it's true. But this is it's worldwide. So if there is an inflammation, ice should work. If ice doesn't work and hot package work better, hot package will increase the vasodilation. So it should worsen up the symptom. It should worsen the symptom because vasodilation will increase the inflammation.
So important point.
As you will see, yeah.
Very important point.
In fact, this make a lot of confusion because people, it's prescribed ice, and then at the end they put the hot package and they feel better. And they are confused because how is possible this? Because this is nociceptor pain. So heat works for nociceptor pain, ice for inflammatory pain.
Okay, so I just want to repeat that to you, so because I thought it was a very important point. So if you are applying cold pack to an area of pain and you are finding that it is helping, that's probably an inflammatory issue. Whereas if you're applying heat to that same pain area and you're finding relief, that might be a myofascia area. That's very interesting to know. We're going to have to wrap it up here, Dr. Stecco, and I do appreciate you coming on to the show. I want to give people your website, and it is www.fascialmanipulation.com. I highly suggest you go to this website. I'm sorry about a little bit of the quality of the show. So if you have any questions, please do feel free to email me. I can put you in contact with Dr. Stecco, or please do look at his website. It's a fascinating area of study. Dr. Stecco, thank you so much for your patience through the little bit of communication error, but I found it to be a very fascinating show. So thank you for joining us. I appreciate it.
Well, thanks so much. Thanks for the invitation, and always a pleasure to talk about Fascia.
Yeah, I think we may have you back on again when we get a better sense of a good, crisp phone line, but I really do appreciate it. Next week, everybody, we will be talking with Sean Swarner about beating all the odds, so do join us. Have a wonderful Easter, and we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio